Alright, team. We have a patient with some concerning symptoms. Epoxidocosapentaenoic acid, trichinitis, and surfer's ear. What could we be dealing with here?
Well, epoxidocosapentaenoic acid is a rare lipid disorder. Trichinitis is usually associated with triangular-shaped organs, and surfer's ear is a common condition among surfers. It could be a combination of underlying issues.
I think it might be a case of a genetic anomaly affecting the anal canal, leading to anorectal anomalies.
You're onto something, Leslie. The surfer probably tripped on his board in a really funny, gruesome manner.
It could also be a severe case of gastrointestinal inflammation causing these symptoms. Maybe we should consider that.
I'm leaning towards some sort of infection that's manifesting in these different ways. We need to run some tests to confirm.
No, you're all wrong. It's anorectal anomalies. Randall, Gary, get ready for a prostatectomy. It's risky, but it's our best shot at saving this patient.
Are you sure, Hawks? It's such a high-risk procedure?
I'm the doctor here, and I know what's best. Now do as I say.
What about us, Hawks? What should Frank and I do?
I want you two to break into the patient's residence. Look for any clues that could help us confirm the diagnosis.
Go now. Time is of the essence.
Tracy, you called me in here to discuss the prostatectomy for my patient with anorectal anomalies. I'm confident in this approach.
Hawks, I have reservations about this. You've been wrong in the past about similar cases.
My experience speaks for itself, Tracy. I've performed countless successful procedures. It's time to trust my judgment on this.
I understand your confidence, Hawks, but we can't ignore the risks involved. We need to consider all options carefully.
Tracy, let's not dwell on the past. This time I know I'm right. Trust me. This is the best course of action for the patient.
What's this I hear about you consulting an animal in a doctor's coat regarding the prostatectomy?
You have one wild imagination, Tracy. I almost envy it.
No. You wrote an email to me before coming in here that you had consulted with someone who claims to be a proctologist who's well experienced with the prostate.
That was probably Gary. I forgot to lock my computer again.
Oh no, the patient is in critical condition. We need to act fast.
Prostatectomy was not the right treatment for anorectal anomalies, as Dr. Hawks had suggested. We need to figure out the right approach.
But what could it be? What should we do now?
We'll figure it out. Maybe Leslie and Frank found something at the patient's home that could give us a clue.
I hope so. We need to find the correct diagnosis and treatment as soon as possible.
Look at this, Frank. The patient definitely has bad cleaning habits. There's clutter everywhere, and I can't even find a clean surface in the whole place.
That's interesting.
Let me take a closer look.
Records.
I have a feeling Dr. Hawks might have jumped to conclusions about the treatment.
Let's see. Mastectomy for anorectal anomalies. That doesn't add up. The clues in this home definitely don't align with that diagnosis.
Did you look at the surfboards in the other room?
I couldn't make it past the door due to the really nasty stench coming from inside of it.
Frank, is there a chance Gary was onto something?
Oh, he's always on something. Wouldn't surprise me if he robbed Hawks's medical cabinet last night with how he's acting today.
No, I'm talking about his odd comment about the surfer possibly landing on his surfboard in a funny way. Do you think it's possible that it wasn't a landing, but more of an insertion?
That's pretty far-fetched even for you, Leslie. Anyway, I didn't bring a mask. I'm not going in that room. Let's just pretend that Gary was right this time. It'll blow Hawk's mind.
How could you all have been so careless? Anorectal anomalies, my ass. You nearly killed the patient with the wrong treatment of prostatectomy.
But Dr. Hawks, what we found at the patient's home wasn't relevant to anorectal anomalies.
We're just trying to consider all possibilities.
What did you just talk about, Frank?
Oh, all right. Well, maybe it's you problem, Hawks. We think Gary was right. The whole house smelled like shit. The guy's a surfer. You do the math.
You've both lost your talking privileges for the rest of the day. I don't want to hear it.
What do you think the correct diagnosis is, Hawks? We need to act fast to save the patient.
Yeah, we're here to help. Just tell us what you think the right course of action is.
You clueless bunch of amateurs. I don't need your input. I'll figure this out on my own. You all better stay out of my way before you do more harm. So, how are things going in the oncology department, Johnson?
Pretty good, actually. My patients are responding well to treatment.
That's great to hear. I've been dealing with this really perplexing case lately. It's been consuming my thoughts.
Oh, what's going on with your patient? Anything I can help with?
Mumbling to himself. Wait a minute. I think I know what's wrong with my patient now.
Hawks, are you even listening to me?
Excitedly, I got it. I know what's wrong with my patient. I have to go, Johnson. I'll catch up with you later.
The bewildered wait. What? You can't just leave like that.
The hell I can't. I have a patient who has a higher chance of surviving compared to yours. I figured it out, everyone. Anorectal anomalies was a misdiagnosis.
Hawks, what are you doing in here without proper protective gear? You can't just storm in like that.
This is absolutely unacceptable, Hawks. You're risking everyone's safety.
Yeah, you need to leave now and come back properly equipped.
Hawks, you can't just barge in here whenever you feel like it.
I was right about the misdiagnosis. It's Creutzfeldt, Jacob disease.
Creutzfeldt, Jacob disease? That's serious. What's the prognosis, Hawks?
Hawks, tell us what the prognosis is for Creutzfeldt, Jacob disease.
Do you have any treatment plan in mind, Hawks?
I can't believe I got it so wrong with the diagnosis.
Don't be too hard on yourself, Hawks. You corrected it in time.
Yeah, but the patient still has Creutzfeldt, Jacob's disease. He probably caught it from my team.
Your team? How does that make any sense?
Well, they should have caught it before it got to that point.
Hawks, you can't blame them for the patient's condition.
No, I think it's impossible for me not to blame them for anything after hearing them suggest a surfboard goes anywhere but the ocean.
That was beyond disgusting.